Are stresses of the pandemic compounding a chronic epidemic of alcohol use disorder in St. Lucia? A recent ban on liquor licenses to combat COVID-19 a few weeks ago stirred passions. No sooner was the ban lifted, came a run on alcohol with an ensuing social media gallery of photos and videos of persons apparently under the influence and engaging in reckless behavior. Law enforcement and medical officials are alarmed at the rate of excessive drinking and the attendant health problems. With the Easter holidays around the corner, St. Lucians are expected to be in the throes of passion once again in their never-ending love affair with the bottle. The Substance Abuse Advisory Council Secretariat hosted a panel discussion on the growing public health issue. Consultant psychiatrist at the National Mental Wellness Center, Dr. Naomi Jn Baptiste, explains that the road to recovery, like most treatment programs, begins with the country admitting that it has a problem.
I saw a lot of videos that were going around on WhatsApp after the alcohol was released, after we had the 2-week stint of no alcohol. And you could see people like they were so happy and insulting everybody and everything, like they don't realize that they have a problem. Everybody else does, but they don't realize. And there's another thing, like a lot of our homes have single parents. And if you have that single parent using alcohol, the children are at risk, because when that parent is drunk, other people could seize the opportunity to go and abuse their children. So that's another thing. So we really need to recognize first that there's an alcohol problem, and we have Turning Point at which is an alcohol rehab center, but then people are reluctant to come forward to go to Turning Point. I don't know if it is because of stigma, or I don't know what it is, but they don't come.
Pathologist Dr. Stephen King homed in on the effects of alcohol toxicity on the body. Dangerous blood or alcohol levels are not just about the rate of consumption, but volume, particularly in cases of alcohol poisoning.
Then you move to about 200 milligrams per deciliter. You've now had about 6 drinks. You are now drunk. That is when you begin to stumble. That's when you can't coordinate properly. Your decision making goes off. You have another 3 or 4 drinks. You've now reached to 300. When you get to 300, we call you dead drunk. These are the people that are beginning, their eyes closing on them, and they want to go and lie down or fall down in a corner. They can't hold themselves up anymore. They are bordering on going into a coma, like Dr. Jn Baptiste mentioned. And if you get to 400, we call you dead. At 400 milligrams per deciliter, you are dead. Your body cannot tolerate that much. The studies show us that most people who die, the average is actually 355 milligrams per deciliter of blood.
Public Relations Officer in the Royal St. Lucia Police Force, Corporal Ann Joseph, has worked with children whose parents struggle with the disease of alcohol use disorder.
One of the responsibilities is actually, as it relates to children, creating safe environments for children, reviewing whether there's any sort of abuse, and psychological abuse is actually unlawful. Yes. So children would be removed from the homes with the assistance of divisions such as the Department of Human Services. Children would be removed from these environments because you have created an unsafe environment. Whether the children are directly abused or not physically is not of concern to us. As long as it's being done in their presence, they're aware something about it is reaching the children, you have created an unsafe environment. So you don't have to be the person beating on the child, but you have created, whether it is by virtue of you being a victim of it, the situation is unsafe for the children.
According to Dr. King, children who grow up in or around alcoholism have less of a chance at success and make poor life decisions. The psychological toll of having a parent stricken with alcoholism can also carry over into adulthood, creating troubling traits and unhealthy behaviors. According to a World Health Organization 2014 report, St. Lucia and Grenada recorded the highest alcohol per capita consumption in the Americas among men and women. Gina Filippi, HDS News Force.